Hi, my name is Dr. Sabrina Quineni, and I have a breast thermography clinic in beautiful Redondo Beach. One of these images right here is something that I do in my breast thermography clinic. But before, I want to teach you a little bit about the differences between a breast thermogram and a mammogram. A mammogram has an equivalent of 50 pounds of pressure on each individual breast, as well as constant radiation by women having their mammograms annually. With a thermogram, what we are doing is there's no compression and there is no radiation. So it's one of the most safe and effective screening tools for the early detection of breast cancer. This is an example of something that I do in my clinic. This person right here has invasive ductal carcinoma. So at this point in time, a mammogram is too late to detect those small, minute abnormal changes. So this lady is coming in at regular intervals to see if her treatment protocol is working for her. So when somebody has invasive ductal carcinoma, let me teach you a little bit about it. Invasive means that it has spread beyond the breast tissues. Ductal meaning that the cancer began in the ducts, but it's invaded through the walls of the ducts and are going towards the rest of the breast tissue. There's also a chance that it can reoccur in surrounding tissues beyond the breast. The American Cancer Society will say that 180,000 women in the United States will have a breast cancer diagnosis, with invasive ductal carcinoma being the #1 diagnosis. For invasive ductal carcinoma, it's imperative that we check the breast at very regular intervals to see if the supplements, if your treatment protocol is working. And right here, we can look, this is a thermogram that was done in September 2015 for the invasive ductal carcinoma. You can see very apparent structural changes in the actual breast tissue as well as the nipple. There's a correlation between an increased risk of breast cancer and an increased amount of blood vessel activity, also known as vascularity in the breast. We can see a definite asymmetry between the left and the right breast. If I were to show you the color imaging as well, you can see the area of inflammation, the area of heat in this left breast compared to the right. So it's important after a certain amount of time that we come back and we check to see the progress that somebody is making. Because thermography, we can look at those small, minute, abnormal changes. So this is February 2016. You can see that her breasts have gotten worse over time, over a matter of a couple of months. You can see more negative changes in the breast tissue. You can see an outpouching, and now from a physical perspective, you can actually feel the lumps. You can see an aggregation in terms of the diameter of the blood vessels from the left breast to the right breast, so we know we're moving in the wrong direction. So this is why breast thermography is so important, so we can take all of this information and make a proactive step towards treating not only her left breast but her right breast before it gets even worse. And so we have a protocol in place so that this lady can start getting on the right track. Thank you, Dr. Sabrina Quineni.